All right, get ready for a deep dive into labor and birth.
Ooh, yes.
We're going to unpack the stages, explore all those key nursing care aspects,
Mm,
and even touch on some of the cultural considerations. You might not expect some of these.
definitely.
Today's deep dive is based on a nursing textbook chapter all about family-centered care during labor and birth.
Yeah, this chapter, it really dives into how those medical and social aspects of birth, how they all kind of intertwine. We're going to be looking at, of course, that physiological process,
Right.
but also that crucial role of the support systems
Yeah.
from those healthcare providers to family members and how to create that safe and positive experience.
It's interesting because, like, you probably already know the basics of labor and delivery.
Mm-hmm.
But did you know that how a hospital handles a woman in labor
Mm-hmm.
is actually a federal matter?
That's right. Thanks to the EMTALA Act,
Uh,
it ensures any woman experiencing an emergency, including active labor,
oh, wow.
gets that medical care that she needs, regardless of insurance or ability to pay.
That's so important to level the playing field when it comes to accessing care.
Absolutely.
But what happens once a woman arrives at the hospital, like ready to give birth?
Right.
What's that initial assessment like?
Well, it's really thorough. They start with a review of your prenatal records
Okay.
to get that full picture of the pregnancy journey up to that point.
Makes sense.
And then there's the interview, where the care team really focuses on understanding your individual needs,
Yeah.
your concerns and preferences.
Uh,
It's all about building rapport and trust from the very beginning.
I can see why that would be so important because labor isn't just a physical event.
Right.
It's a deeply personal one.
Exactly. And that's why considering psychosocial factors is crucial. Stress levels,
Yeah.
any cultural nuances that might influence birth practices,
Okay.
the individual support system, all these play a part in shaping that whole experience.
So it sounds like the care team is really trying to understand the whole person, not just checking off boxes on a chart.
Mm-hmm.
What about the physical exam? What's involved in that?
It's a multifaceted assessment.
Oh, wow.
There's the general health check,
Right.
vital signs, of course,
Yeah.
and something called Leopold maneuvers.
Leopold maneuvers. I've heard of those,
Yes.
but I could never remember what they were.
Basically, it's like a gentle puzzle where the healthcare provider uses their hands to feel your belly and figure out the baby's position in the uterus. It helps them kind of know what's going on
Okay.
and what we might need to do to encourage the baby into the right position for birth.
Oh, that makes sense.
Exactly.
Getting all the pieces in place.
And of course, continuous monitoring of the baby's heart rate
Right.
throughout labor. Hearing that heartbeat can be incredibly reassuring for expectant parents.
Ah.
And then we also assess the uterine contractions,
Mhm.
how frequent, intense, how long they last,
Mm.
and the resting tone between them. All these factors kind of paint a clear picture of how labor is progressing.
So many things to keep track of.
Right.
Wow.
And then there's the vaginal exam to check your cervical dilation and effacement,
Okay.
which tells us how close you are to giving birth.
So that's how they figure out, like, how far along you are, right?
Exactly.
Okay.
Plus, any lab and diagnostic tests as needed.
Right.
So, analyzing urine, doing blood work, other tests to ensure everything is okay with both you and the baby.
Mm.
They're also carefully checking the amniotic fluid and membranes for any signs of potential problems.
You're really looking out for everything, from the big picture to the smallest details.
Trying to.
But let's talk about the actual nursing care during this first stage of labor.
Okay.
What can you expect in terms of support and comfort measures?
Well, during this stage, nursing care is all about evidence-based practices that have been shown to lead to the best outcomes.
Okay.
This includes encouraging good hygiene,
Right.
ensuring you're getting proper nutrition and hydration,
Okay.
and then helping you manage those elimination needs.
It sounds like the goal is to create an environment that's both physically comfortable and emotionally supportive.
Absolutely.
Is that where that whole family-centered care comes in?
Exactly. We encourage you to move around, try different positions that feel good,
Yeah.
and have your support team close by. This might include your partner, a doula, family members, whoever makes you feel safe and empowered.
Mm-hmm.
This chapter even talks about the presence of siblings during labor and birth, which is really interesting.
Well, I never really thought about that. It really emphasizes how every family is unique,
Mm-hmm.
and that support system can look different for everybody.
Exactly.
But regardless of who's there, the focus seems to be on promoting a natural, positive birth experience.
Absolutely.
Now, I know you always have to be prepared for potential complications or emergencies,
Of course.
but the overall goal is to work with your body's natural processes as much as possible.
Exactly. So this first stage is all about preparation, laying the groundwork for the main event, the baby's arrival.
Okay, so that brings us to the second stage of labor, right? This is where things get really exciting.
It is. This stage is all about the baby's birth. It starts when you are fully dilated, that's 10 centimeters,
Okay.
and 100% effaced.
10 centimeters and 100%. Got it. That's the magic combination we're looking for. And how long does this stage usually last?
Well, there are generally accepted time limits for the second stage,
Okay.
just to ensure both your safety and the baby's.
Right.
But you might be surprised to learn that this stage actually has 2 phases.
Oh.
So the latent phase is usually calmer, with the baby just passively descending through the birth canal.
Okay.
And then comes that descent phase,
Yeah.
characterized by active pushing and strong urges to bear down as the baby moves further down.
So it starts slow and steady, then kicks into high gear.
Exactly.
I bet there are some pretty clear signs that birth is imminent.
Oh, yeah.
Like, what should you be on the lookout for when it's almost go time?
Well, as the baby descends, you might feel increased pressure in your pelvis and rectum.
And that urge to push, it becomes much stronger.
Yeah.
Almost impossible to resist.
Right.
There's also some physical signs that the care team will be watching for, like bulging of the perineum. Oh, wow. Increased bloody show.
So it sounds like things are getting very real at this point. What happens next to prepare for the actual birth?
A lot happens quickly. We focus on helping you find a comfortable and effective pushing position.
Right.
You might choose to be upright, squatting on your side,
Oh, wow.
or even on your hands and knees, whatever feels best and helps that baby descend. Of course, baby's heart rate is still being monitored continuously, and your support person plays a crucial role, offering encouragement, comfort measures, a reassuring hand to hold.
You're really highlighting how this is a team effort,
It is.
with everyone working together to support the birthing woman.
And while we're talking about working together,
Yeah.
I think this chapter's emphasis on communication and shared decision-making is really important.
Makes sense. It highlights how crucial that open dialogue is between you, your family, and the healthcare team.
Yeah, it makes sense that feeling empowered to make those choices about your birth experience would lead to a more positive outcome.
Absolutely. And this includes everything from discussing pain management options, we haven't touched on that yet, but we will, to deciding who's going to be present in the delivery room. You're the expert on your own body, your own preferences, and the care team is there to support you in making those choices.
So it's about creating a collaborative partnership, not just following a rigid set of rules. But okay, let's get back to the action.
Okay.
The baby is about to be born.
Right.
What can you expect as the baby actually emerges?
So let's assume that the baby is in a head first or vertex presentation, which is the most common. So the birth of the head comes first, followed by the shoulders, and then the rest of the body emerges.
This is probably a silly question, but how do they know when to, like, catch the baby? With all that going on.
Well, there are some clear signs, like the baby's head crowning, which means it's visible at the vaginal opening.
Oh, okay.
And so the care team will gently guide the baby out, ensuring a safe and controlled delivery. And then, of course, there's that incredible moment when you hear that baby's first cry.
Oh, I bet that's magic.
Yeah.
But even with everything going smoothly, can't things still go wrong? What about things like perineal tearing, for example?
Yeah, perineal trauma can occur during childbirth.
Right.
And this chapter really emphasizes preparing you for that possibility.
So what kind of trauma can happen? And didn't they used to do episiotomies all the time to prevent tearing?
You're thinking of that surgical cut to the perineum.
Right, yeah.
Which used to be routine, but the routine use of episiotomies has declined because we now know that in many cases, the body can handle the stretching on its own.
So the focus now is on letting things happen naturally as much as possible.
Exactly, and there are things that you can do to help minimize that risk of tearing.
Okay.
Like perineal massage during pregnancy.
Oh, right.
Warm compresses during labor. But even with those precautions, tearing can happen.
Right.
It's important to know that there are different degrees of tearing. Most tears are minor and heal well with proper care.
Okay.
But those more severe tears may require stitches.
This all makes me wonder, what happens if a woman has a history of trauma, like sexual assault? Would that impact how she approaches childbirth?
That's a really important question.
Yeah.
And the chapter does acknowledge that past trauma can significantly influence a woman's birth experience.
Right.
The care team needs to be aware of this and approach the situation with extra sensitivity and compassion. Really creating that sense of safety and control for the woman is paramount.
It sounds like open communication between the woman and her care providers is more crucial than ever in those situations. Okay, let's move on. The baby is born. What happens next?
Well, we're not done yet. Now comes the third stage of labor, which is all about the delivery of the placenta.
I know this might sound strange, but I always feel kind of bad for the placenta.
Huh?
It works so hard the entire pregnancy, and then, well, it just gets tossed aside.
Right.
What happens to it after it's delivered?
Believe it or not, the care of the placenta after delivery is another area where cultural traditions really come into play.
Oh, really?
Some cultures bury it,
Okay.
others eat it. There are all sorts of beliefs and practices.
That's fascinating. It makes you realize that even something as seemingly straightforward as the placenta
Yeah.
can have deep cultural significance.
Mm-hmm.
But before we go down that rabbit hole, what are the signs that the placenta is ready to be delivered?
Well, we look for several key signs, like the uterus becoming firm and round,
Yeah.
a sudden gush of blood,
Oh, gosh.
and the umbilical cord lengthening.
Okay.
All these kind of indicate that the placenta has detached from the uterine wall
Yeah.
and is ready to come out.
It sounds like the care team is constantly observing and assessing, making sure everything progresses safely. What are they monitoring in the mother during this stage?
They're carefully monitoring your physical status
Okay.
to watch for things like excessive bleeding,
Right.
changes in vital signs,
Uh-huh.
or any signs of complications.
Okay.
It's all about ensuring a smooth recovery. But speaking of recovery, we're actually already entering the fourth stage of labor.
Wait, already?
Mm-hmm.
I thought the placenta coming out was the end.
Think of the fourth stage as the beginning of the postpartum period.
Okay.
Those first couple of hours after birth.
Okay, that makes sense. So this is when things start to calm down.
Yeah,
And everyone can finally relax a bit.
not quite. While things are definitely less intense,
Yeah.
there's still a lot going on. We shift focus to assessing your recovery
Okay.
and ensuring that you're comfortable.
So what are the key aspects of care during this fourth stage? What can you expect?
Well, during this stage, monitoring vital signs, checking for bleeding, making sure the mother is comfortable.
Mm,
If she had any pain meds or anesthesia during labor, we're monitoring that recovery as well.
right.
It's a time of transition for everyone involved.
I imagine.
And it's not just about the mother's physical recovery either.
Yeah.
We're also focused on supporting her as she adjusts to her new role as a mom.
Oh, of course.
This includes guidance on things like breastfeeding, managing pain,
Okay.
and just navigating those early days of newborn care.
Wow. So
Right.
much to think about.
Right.
And of course, we're extending that support to the whole family as they welcome this new member.
Absolutely. It really takes a village. You
Mhm.
know, it really reinforces that whole family-centered approach we've been talking about.
That it does.
It's not just about getting the baby delivered safely.
Right.
It's about providing that ongoing care
Mm-hmm.
and those resources to help the whole family thrive.
Yeah. You know, we've talked about the medical side of things, the emotional aspects, even those cultural influences.
Mm-hmm.
It makes you wonder if there's a bigger picture we're missing here.
You're right. There's always more to explore.
Right.
Remember how we were talking about those cultural variations in childbirth practices?
Yeah.
It made me think about how, in some cultures, childbirth isn't just viewed as a medical event, but as a rite of passage.
Ooh, that's a really interesting perspective.
Yeah.
I never thought about it that way before.
It's a powerful way to kind of reframe this whole experience. Childbirth is a transformative event,
Right.
not just for the mother,
Yeah.
but for everyone involved.
For sure.
It's a time of immense change, both physically and emotionally.
It's like stepping across a threshold into a whole new chapter of life.
Yeah.
And just like different cultures have rituals and traditions for other rites of passage,
Mm-hmm.
they also have those unique ways of honoring and supporting women as they go through childbirth.
Exactly. Maybe it's not always about the sterile environment of a hospital room,
Right.
but about creating a space that feels sacred,
Yeah.
a space that acknowledges that profound transformation that's taking place.
So in a way, it's about honoring the power and significance of this transition, even if it's happening in a medical setting.
And providing that emotional and spiritual support that's needed during this vulnerable
Right.
but incredibly powerful time.
Well, we've certainly covered a lot of ground in this deep dive.
We have.
From those nitty-gritty details of each stage of labor
Mm-hmm.
to those broader cultural and emotional considerations,
Yeah.
hopefully you're walking away with a deeper understanding of this amazing process
Yeah.
and a new appreciation for the strength and resilience of women and families everywhere.
I think one of the most important takeaways is that every birth experience is unique.
Absolutely.
There's no single right way to give birth.
Yeah.
And it's about finding what feels right for you
Mm-hmm.
and your family.
Some births are smooth and predictable, others are more challenging. But every birth is a story, and it deserves to be approached with compassion, respect, and a commitment to providing the best possible care.
Absolutely. If I could leave you with one final thought, it would be this.
Okay.
While we've covered so much today,
Yeah.
that journey of childbirth is ultimately a personal one.
Right.
There's no substitute for those open and honest conversations with your healthcare provider,
Mm-hmm.
exploring your options,
Yeah.
figuring out what feels right for you and your family.
It's about empowering yourself to make those informed choices
Exactly.
that align with your values and preferences.
And remember, no matter what path your birth journey takes, you are strong, capable, and deserving of support every step of the way.
It's a beautiful sentiment to end on.
Oh, thank you.
Thanks for taking this deep dive with us. Until next time, keep exploring, keep asking questions, and keep diving deep.
It really is. We monitor those vital signs, check for bleeding, and make sure that you're comfortable. If you had any pain medication or anesthesia during labor, we're monitoring that recovery as well.
Right, right. I imagine those first few hours can be a whirlwind of emotion
Oh, yeah.
as the reality of parenthood sinks in.
Absolutely. And it's not just about the mother's physical recovery either. We're also focused on supporting you as you adjust to that new role.
Oh, of course, yeah.
This includes guidance on things like breastfeeding, managing pain, and navigating those early days of newborn care.
Wow, so much to think about.
Right. And of course, we're extending that support to the entire family as they welcome their newest member.
It really takes a village. It really does reinforce that whole family-centered approach we've been talking about. It's not just about getting the baby delivered safely. It's about providing that ongoing care and those resources to help the whole family thrive.
Mm.
You know, we've talked about the medical side of things, the emotional aspects, even those cultural influences. It makes you wonder, is there a bigger picture we're missing here?
You're right. There's always more to explore. Remember how we were talking about cultural variations in childbirth practices?
Yeah.
It made me think about how in some cultures, childbirth isn't just viewed as a medical event, but as a rite of passage.
Ooh. That's a really interesting perspective. I've never thought about it that way before.
It's a really powerful way to kind of reframe this whole experience. Childbirth is a transformative event,
Right.
not just for the mother, but for everyone involved. It's a time of immense change, both physically and emotionally.
It's like stepping across a threshold into a whole new chapter of life. And just like different cultures have rituals and traditions for other rites of passage, they also have those unique ways of honoring and supporting women as they go through childbirth.
Exactly. Maybe it's not always about the sterile environment of a hospital room, but about creating a space that feels sacred, a space that acknowledges that profound transformation that's taking place.
So in a way, it's about honoring the power and significance of this transition, even if it's happening in a medical setting.
And providing that emotional and spiritual support that's needed during this vulnerable
Right.
but incredibly powerful time.
Well, we've certainly covered a lot of ground in this deep dive, from those nitty-gritty details of each stage of labor
We have.
to the broader cultural and emotional considerations.
Mhm.
Hopefully, you're walking away with a deeper understanding of this amazing process and a new appreciation for the strength and resilience of women and families everywhere.
I think one of the most important takeaways is that every birth experience is unique.
Absolutely.
There's no single right way to give birth.
Yeah.
And it's about finding what feels right for you and your family.
Some births are smooth and predictable, others are more challenging.
For sure.
But every birth is a story, and it deserves to be approached with compassion, respect, and a commitment to providing the best possible care.
Absolutely. If I could leave you with one final thought, it would be this. While we've covered so much today, that journey of childbirth is ultimately a personal one. There's no substitute for those open and honest conversations with your healthcare provider, exploring your options and figuring out what feels right for you and your family.
It's about empowering yourself to make those informed choices that align with your values and preferences.
Exactly. And remember, no matter what path your birth journey takes, you are strong, capable, and deserving of support every step of the way.
That's a beautiful sentiment to end on. Thanks for taking this deep dive with us. Until next time, keep exploring, keep asking questions, and keep diving deep.